In this video, we will discuss high-yield concepts of internuclear ophthalmoplegia, also called INO. To fully understand this disease, we need to have a grip on some structures of central nervous system. Imagine this is a normal person. He is looking at you and wants to move towards his right. Now what will happen that 6 nerve nuclei of right side will send signal to lateral rectus of same side. And right eye will move towards the right side under the influence of lateral rectus. In the meanwhile, same 6 nerve nuclei will send signal to third nerve nuclei of left eye. This signal is sent through a highly myelinated tract which is called medial longitudinal fasciculus. And this lecture is all about this tract, medial longitudinal fasciculus, or called MLF. This is normal mechanism of a working eye. Later we will discuss a clinical scenario related to internuclear ophthalmoplegia or a defect in medial longitudinal fasciculus. What causes internuclear ophthalmoplegia? In children, we are mostly suspecting neoplasm. In adults, we see demyelination disorders like multiple sclerosis and others. In older patients, we are suspecting ischemia like stroke because medial longitudinal fasciculus is supplied by basilar artery, and any kind of stroke affecting basilar artery will result in internuclear ophthalmoplegia. This disease can be unilateral or bilateral, and all of this depends on the underlying cause. Other causes of internuclear ophthalmoplegia include infections, trauma, hydrocephalus, and metabolic disorders. Let's discuss what patient says when he or she comes to your clinic. These patients cannot track fastly moving objects. Also, there are complaints of diplopia or double vision. The signs you will see in the examination of a patient with INO will be slow adducting saccades, convergence is preserved, limited or no adduction of affected eye, and there will be nystagmus in the fellow eye, and we are discussing this in a clinical scenario now. Imagine there is a patient who has any defect in the right medial longitudinal fasciculus. This patient is looking towards you. This is his right eye and this is his left eye. When this patient looks towards this side, normally lateral rectus of right eye will contract and medial rectus contracts to make a successful horizontal gaze. But when this patient having a defect in right medial longitudinal fasciculus looks towards his left, there will be impaired adduction of right eye because signal from the right medial longitudinal fasciculus is not coming to third nerve nuclei. And left eye will move towards the left with mild nystagmus due to overfire. Remember that right INO will give right eye adduction failure and left INO will give left eye adduction failure. These are gaze positions of a patient with left INO. This is a normal position, and this is when patient is looking towards the right side, and this is position of eyes when patient is looking towards the left side. The treatment of internuclear ophthalmoplegia lies under the flag of treating the underlying cause. Treating the underlying cause will correct the gaze positions. This is all about internuclear ophthalmoplegia. Kindly subscribe to our channel to show support. Thank you.